Hey guys, so you've got this pain down there. You go to the doctor, he says you've got prostatitis. What's up with that? Are you screwed? Hey guys, it's Doc Heps here. So the question is, you have this pain kind of down below, you go see the doctor, he says you have prostatitis. So what's the deal? We're gonna go over some information on what the prostate is, what's prostatitis, what's normal, what's abnormal, what you should be concerned about, what to expect, and we'll go over some highlights, kind of take-home points that hopefully will provide value and information so that you can feel better and just learn more about your body. Let's start with just an overview of what the prostate is, what it does, some of the basic anatomy, and we'll go from there. The prostate is a gland that produces fluid in the ejaculate. It basically helps the sperm to survive and penetrate the egg. Beyond that, the prostate can just cause some nuisance and potentially dangerous symptoms. Anatomically, here's a diagram. As you can see here, this is the bladder, the prostate is below the bladder, and then this is the urethra. There's a transition from the urethra to the prostate to the bladder. Although they're separate organs, they are all integrated. This is a blow up of the prostate. As you can see up here is the bladder. This is a prostate. The bladder pushes urine through this channel. These little lines or tubes are the ducts through which the prostate produces its fluid. So that's in a quick nutshell what the prostate does. Now, some of the problems that can arise with the prostate are enlargement, which is a common problem that affects actually most men and really doesn't always cause symptoms. Sometimes it's very normal for men to have some urinary symptoms as we age, and the prostate just enlarges progressively as we age. Again, some men have urination problems, some men don't. And this can be attributed to benign prostate enlargement. Now, another thing could be cancer. Obviously, you may have heard about prostate cancer. Those are dealt with in a different series of videos, which you can check out. Third is inflammation. The prostate can get inflamed, just like other organs of the body can get inflamed. And this causes a somewhat specific yet vague constellation of symptoms that can affect a number of men, and in some men it can be pretty miserable. Number one important thing is that prostatitis, which is an inflammation of the prostate, is benign. It's not associated with cancer. That's definitely a key take-home message. Prostatitis is inflammation of the prostate, and we divide this into four major categories. The first, and probably fairly easy to diagnose, is something called acute bacterial prostatitis. And in this situation, there's a bacteria that gets into the prostate. This can be from the urinary tract or from a source we're not sure of. It causes an infection in the prostate. And most men get pretty darn sick. You can have fevers, pain, pressure, difficulties voiding. Most men will come in and they'll be fairly sick, and some men sick enough to require going into the hospital and getting intravenous or IV antibiotics. Usually the level of inflammation in your entire body is elevated, and we pick that up with what's called a white blood cell count on a set of blood work tests. And oftentimes the whole pelvis and perineal area, which is the area between the testicle or scrotum and the rectum, can be very sensitive and tender. Again, most men are sick. They look like they have a bacterial infection or an illness. They just feel lousy, wiped out, have fever, chills. Oftentimes a prolonged course of antibiotics will help. cure that. Another type of prostatitis is something called chronic bacterial prostatitis. Now, this is related to the acute bacterial infection, but men tend not to get as sick. It's more of a bacterial infection that kind of smolders and lingers within the prostate and causes these intermittent waves of urinary symptoms, pelvic pain, pain with sex and ejaculation. It can cause that perineal pain. Some guys feel like they're sitting on a golf ball. Oftentimes it's not associated with an elevated white blood cell count. It's not associated with fever, chills, or that severe sickness. Hence, we call it a chronic bacterial prostatitis. The chronic nature is such that it tends to recur in some men. So this is, again, is treated with antibiotics. Oftentimes, a prolonged courses are needed to eradicate the infection. And it's more common in men who have urinary tract infection or testicular infection, or have a catheter that might be inside their urinary tract. These can promote chronic bacterial infection or prostatitis. So a third type, which affects a significant portion of men, which is probably the most frustrating for men, for both the patient and actually the urologist, is something called chronic non-bacterial prostatitis, or we typically refer to this as chronic pelvic pain syndrome. And there's a whole grading system amongst this chronic pain system. But basically, there's no evidence for any bacterial infection, but gentlemen have this constellation of pelvic pain, pain with intercourse, pain with ejaculation. Sometimes they may have burning when they urinate, and a myriad of urinary symptoms, including urgency, frequency. Sometimes it'll be difficult to empty. Sometimes they'll have a sensation of incomplete emptying, and these symptoms can be very inconsistent. These symptoms flare up and go away. They usually linger for a while, and then they may get better, and we don't necessarily know why this occurs. And so for the patient, it's extremely frustrating in that we will rule out anything bad going on, but they still have these symptoms. And we as urologists say, hey, there's nothing bad going on. We can throw these medicines at you that may or may not help, but most men will just get better with tincture of time. The medicines may help improve the symptoms and allow you to basically tolerate the symptoms as the body heals itself. The last type of prostatitis is more of a diagnosis that we find incidentally when we do prostate biopsies. And this is called asymptomatic inflammatory prostatitis. Basically, when this happens is we're usually investigating for prostate cancer in a gentleman who may have an elevated PSA. We perform a prostate biopsy, and ideally that gentleman has no evidence for cancer, but on the biopsy they find some inflammatory cells. And that's called asymptomatic inflammatory prostatitis. Typically we don't do anything, and the vast majority of these men don't even know they have this inflammatory component. What can be some of the causes of prostatitis? Well, most times we just don't know. And that, again, is a frustration for urologists as well as the patients. But as urologists, our job is to make sure there's nothing bad going on. So we want to make sure we rule out any cancers. The other things that can cause this, as mentioned, is bacteria. In both acute and chronic bacterial prostatitis, men who have a urinary tract infection or a testicle infection, these structures are connected to the prostate and can lead to an acute or chronic bacterial prostatitis. Other men that have catheters or some sort of instrumentation of their bladder can also have a higher risk for bacterial prostatitis. And in men who have chronic pelvic pain, we think there's some inflammatory problem going on in the pelvis, and this can be affecting the muscles of the pelvis. So the muscles of the pelvis are like a basket or a funnel, and through those muscles pass the urethra and the rectum. And the prostate sits at kind of the apex of that funnel or basket of muscles of the pelvis. So if those muscles are inflamed, it can cause pain, discomfort, and we don't know whether the muscles have a problem and are causing the prostate symptoms and urinary and potentially rectal and bowel movement symptoms, or vice versa. Did the prostate become inflamed and then pass that inflammation to irritate and agitate the muscles of the pelvis? So in order to treat that, sometimes we use anti-inflammatories, sometimes we'll use physical therapy. I think pelvic floor physical therapy is widely underutilized. I never formally trained in it, but I think it has helped many of my patients. And collaborating with a good pelvic floor physical therapist can help many men and women with their urinary symptoms. So let's move on to diagnosis. So typically, men will either see their primary care or they'll see their urologist. They'll describe what's going on. We'll take a good history. We'll do an exam. We'll do a prostate exam, testicle exam, and we'll also test your urine to make sure there's no overt infection or blood. We'll likely do some blood work to include a PSA blood test. And if the urologist thinks it's necessary, maybe a CBC that would include a white count. We may want to order an ultrasound or a CT scan, depending on your symptoms and what your urine and PSA look like. Sometimes anatomic imaging, getting a picture, will help guide us to ensure that nothing else is going on, such as a stone or some sort of blockage that may be attributable to your symptom. Typically, these tests are all normal. And oftentimes men are frustrated that they're normal because they want a diagnosis to hang their hat on that will get them better. And that's totally normal. We as urologists want to find out what's going on and treat it. But unfortunately, in many men with prostatitis, it's more of a rule out anything bad and sort of treat the symptoms until the body heals itself. How do we treat prostatitis? Well, there's installation of medications that may help. In bacterial prostatitis, the foundational treatment is antibiotics. If there's a bacterial infection, we'll send a urine culture and we'll start you on antibiotics. Most men will need 4 to 6 weeks of antibiotics in order to eradicate any prostate infection. It's a long course, and some men are hesitant to complete that course, but the worry is if you don't take enough antibiotic, the bacteria won't be fully eradicated, and the symptoms may temporarily improve and then recur down the road. Other things we use are mostly kind of band-aids. They treat the symptoms. So these include alpha blockers like tamsulosin. It relaxes the muscle cells on the prostate in hopes of improving your voiding symptoms. Also foundational are anti-inflammatories. If prostatitis is an inflammation of the prostate, anti-inflammatories ranging from ibuprofen, Aleve, or naproxen really can help men manage their symptoms while the body is healing. Pelvic floor physical therapy. As I mentioned previously, I think that pelvic floor physical therapy is vastly underutilized in urology. So if you have access to a good pelvic floor physical therapist, they would be an asset in treating the muscles of the pelvis to help decrease your symptoms and help you feel better. Some key takeaways I want to leave with you are Prostatitis is very common. Again, it occurs in greater than 200,000 people a year. There's a real burden with prostatitis, and I don't want you to feel like you're alone in this. It can last from a few weeks to a few months, and inconsistency is the most consistent component with this prostatitis symptoms, so that one day you may be feeling pretty good and the next day you have a flare-up. Healthier you are in terms of your lifestyle, I think the less likely you'll have a recurrence. In terms of the diagnosis, we basically, as urologists, we rule out the bad stuff. We want to make sure there's no cancers. We want to make sure there's no active bacterial infection that will make you really sick. And then it's really treating your symptoms with a myriad of different medicines that may help. Hopefully you enjoyed this talk and provided you some value and insight into what the prostate is, what inflammation of the prostate is, prostatitis. Thanks for watching. Appreciate your comments. Please look at our other videos. We'll go into some deeper dives in some other areas that I may have mentioned. And again, have a great day.